Laughing gas or nitrous oxide is making a big comeback here in the US, but is it the right option for pain management in labor for you? So in this video, we're going to go through details about how nitrous oxide is administered, whether it really works, and the safety. And first of all, I've just got to start with how easy it is. Nitrous oxide is as easy as getting a mask that is connected to the nitrous oxide machine from your nurse, putting it on your mouth, and breathing. It's that easy. So when you compare it with an epidural, it is kind of night and day on how quickly and easily this pain management option can be tested out. Now, if you're wondering why the heck I have a nitrous oxide mask with me, well, I had a client recently that was thinking about using nitrous at her birth, and her labor and delivery nurse set it up. Ended up that she didn't use it at all. And when they were cleaning up the room after the baby was born, the nurse handed this to me and asked me if I had kids at home because they love to play with this. My kids are a little too old to play with it, but I knew I wanted to play with it in a YouTube video. With this mask, you're breathing in a colorless, an odorless, a tasteless gas. And you're self-administering this pain relief. So as you put the mask on and you're breathing in, that's when you're going to feel that relaxation, gentle relaxation, sometimes it's described as, with the nitrous oxide. And then as you take the nitrous oxide off, maybe give yourself a few breaths of just normal room air, the effects of the laughing gas actually fade. And so what we see that works for a lot of people is that as a contraction is starting and you feel it starting, then you put the mask on and breathe normally through the contractions, but with the mask on. And then as the contraction is over, you take the mask off and breathe regular room air. So it's really a quick and easy self-regulation process. And from what I've seen working with my clients, it does take sort of a few contractions to get into it. And that's like most pain relief. A lot of times it's not instantaneous. Even if you are trying an epidural, it's not instantaneous. But after a few contractions and after breathing into your system, you sort of get a rhythm as to the type of pain relief that you can get from nitrous oxide. So what I mean by this is I wouldn't give up on it if you put it on and all of a sudden you have, you don't like it or it's not really helping. I'd probably settle into it for a few contractions before you can really judge whether or not it's working for you. So one of the things that's great about this sort of easy to use, easy to set up, easy to try, is that it does kind of take away that barrier that sometimes we feel with an epidural, where we have to have kind of a setup, we have to get an IV and those type of things. With the nitrous oxide, the setup time is usually shorter and easier. So it's something that we can try out. If it's not working for us, then we can move on to other forms of pain relief. The type of relief you're probably going to get from nitrous oxide is more of that relaxation, like I mentioned. And it's a bit of I don't care as much about my contraction. The pain isn't bothering me as much. So it's different from the epidural. The epidural actually numbs the pain, takes the pain away with a good epidural. The nitrous oxide doesn't take away the pain. It actually numbs your mind to the pain. It makes you care less about the pain. So they are very different in that way. So let's move on to safety. Nitrous oxide is an option for pain management that has very little side effects. So a common question about laughing gas is whether or not it has any effect on your baby. And the great news is that research tells us that babies are not affected by nitrous oxide. And you can kind of imagine this to be true in that it leaves your system so quickly. So if it affects you with the mask on, and then when the mask off, it's already making its way out of your system. So for yourself, side effects that some people experience with nitrous oxide is nausea or dizziness. So if that's something that you're experiencing while you have that mask on, while you are using the nitrous oxide, the easiest way to get through that is just to stop using it and to stop with that method. Also, very different from an epidural. So if you have a side effect with an epidural, it's not something that you can just take out, turn off that easily. It generally has a much longer sort of impact on your system as far as you have the catheter in, you have the medication in your system. So it's not as quickly on and off if you are experiencing side effects, which that's pretty cool. I think the sweet spot of nitrous oxide for a lot of people is using it for a short period of time. So it is kind of sometimes used as a bridge, either a bridge from the end of labor to the pushing phase, which is usually during that transition phase. I know I've personally worked with clients where nitrous oxide was the perfect solution when they were wanting to avoid an epidural, but they needed a little bit of help at the end to get through that pain. And nitrous was just that perfect help, that perfect bridge through the transition phase. So it's often a short time use. So while people do use nitrous for hours and hours, a lot of people say that it worked best in short periods of time. So in that transition phase, it's also great in that you can use nitrous at any phase of your labor. So it's something that could be used in early labor, in active labor, transition, or pushing, which unlike the epidural, sometimes it's not ideal to get an epidural maybe right before you start pushing, because by the time it affects your system, gets into your system, those contraction pains are more pushing pains and maybe not as beneficial. The other thing that is interesting and I think notable about using nitrous oxide is that you can use it as a bridge to an epidural. So sometimes if you are trying to maybe labor for as long as possible without an epidural, or maybe you are kind of caught off guard by your contractions where they sort of ramped up really quick and you're waiting for an epidural, the nitrous oxide could be a good bridge between, your other pain management techniques that you've been doing and the epidural. For that wait time, you can use or try nitrous oxide. So sometimes people at this point will use IV narcotics or IV, you might have heard them called IV pain meds, to kind of take the edge off while they're waiting for an epidural. But a benefit to nitrous that is unlike IV narcotics is that it does not have an impact on the baby. And it is very quick acting like the IV narcotics. So that's really cool. And then the other thing that I think is great that a lot of people don't know about with nitrous oxide, laughing gas, is that you can use it for a repair. So if you experience a tear at birth and maybe you have a significant repair that your doctor needs to do and can be quite uncomfortable, you can use nitrous oxide for that repair to help relax. Have that gentle relaxation while you're going through kind of that really annoying repair that's very important, but something that most people don't want to do when they're ready to just be done with everything. If you're starting to think that nitrous might be right for you, the next best step is to find out if it's available where you are planning to give birth. So bigger cities in the US are more and more hospitals are adopting nitrous as an option, but it's not available everywhere, which I know is super frustrating. I would either give a call to the hospital, ask your providers at your next visit, ask your doula, childbirth educator in the area that you know to see if nitrous oxide is going to be an option for you. And if it is, start thinking about your ideal scenario on when you would like. Definitely talk to your partner about it so that they are also on the same page. And if you are also weighing your options for pain management and thinking about using an epidural, I'm going to put my favorite, most helpful video about epidurals right here so you can take a look at that. And if you found value in this video, then I know you will love other videos. Please subscribe to the channel and give this video a like, and I'll see you next time.